4 years ago, the Mobile Crisis Team was formed, and recently Sheriff Moon and others had an opportunity to speak before the Nevada County Board of Supervisors to provide an update on the MCT's impact to the community. For those familiar, or unfamiliar, I should say, with the MCT, it pairs a mental health clinician with a deputy sheriff on mental health-related calls. Here in the studio is our Nevada County Sheriff, Shannan Moon, to tell us all about this program. Thank you for coming, Sheriff Moon.
Thank you for having me.
Pleasure to have you.
Yeah, thank you.
Well, can we just start by having you explain what the crisis team does and why it was formed and things like that?
Yeah, so I was elected to start my first term in 2019, and as I worked in this community as a deputy sheriff, as a detective, as a supervisor, clearly we have seen lots of calls for service where people are in crisis, mental health crisis specifically. And throughout the state, throughout the country, there has been a high priority on the training involved for officers so that they can successfully navigate those types of calls. And I started seeing other agencies and some of the programs that some of the larger agencies throughout not only California but throughout the country were providing for their communities, where they would pair a licensed clinical social worker with a deputy sheriff to respond to some of those calls. And it absolutely spoke to me. I was involved with lots of different calls for service in the community with people in crisis. And the way in which our system here in Nevada County worked prior was if a deputy sheriff believes that someone is unable to care for themselves or others, or is a danger to themselves or others, you can detain them and have them go see a clinician. And typically it's at the hospital. Nevada County is a pretty vast county, over 900 square miles. Yeah. So we would have contacts with individuals in crisis, doing the best that we could as deputy sheriffs and saying, okay, we need you to go speak to a clinician, and we would have to transport them from their residence, from their location that they were in crisis, all the ways into Sierra Nevada or Tahoe Forest up in our Truckee area. And we'd get there, and the scene, the situation would be calmed down. The person would have had time to calm down and think a little bit clearer because of the time of that transportation. And they would get to a clinician, and the clinician would either say, yes, they need to be detained longer, or no, give them a ride home. And it just seemed to me to be very ineffective and in a time restraint. When deputy sheriffs, our resources are thin, there's other crimes being committed throughout the community, and as a supervisor, and you have one of your deputies off the roster because they're truly working to try to help someone, it just, the efficiencies were just not there. So in talking with some of the other agencies across the country that were pairing a clinician, so that clinician is in the field, absolutely able to see the people where they are in crisis, because sometimes when you see someone where they live and how they're living, and it's not just that person that's in crisis, it's the family that's in crisis, it's the parents, it's the siblings, it's the neighbors, this doesn't happen in a vacuum. So how can we provide a better service, and by pairing a clinician to being able to talk to different people and really get down to the foundation of an issue, and then being able to write those detention orders from the field, bring them into a clinical space, and getting the help that people need.
Yeah. That sounds good. And I think you're right. Looking at the whole picture is really important, not just of, like you said, the family and friends that are surrounding that person, but also all the help that's available that could be surrounding that person if there was better communication.
Better communication.
Or maybe I should even say better commitment. I know that I did some work with Loaves and Fishes down in Sacramento, and it was the Catholic Church, the nuns that ran that, and they also have hospitals. And what they were finding was that the ERs were being overrun with people like what you're saying in crisis. And what else do? You take them to ER. So what they ended up doing is issuing grants to organizations like your own and clinicians and other organizations that help, the people the people that need the help. And so to get those grants, you were required to participate in a database, where you all share. Because when you pick somebody up, it would be nice, I'm thinking, that you could pull them up into your database and see if they had, they just saw somebody last week.
Absolutely, absolutely. It's that continuum of care, right?
Yes,
Things don't just happen, whether it happens through weeks, months, years. What worked for treatment and what didn't, I think is also important, so that the health providers don't have to start at zero if treatment has been successful in the past. And definitely having clinicians in the cars with the deputy sheriffs, the way in which a call for service happens, whether it comes through a 911 call or someone just randomly calling the sheriff's office and saying they have an issue, they need a welfare check on a family member that's been suicidal, or the clinicians and the deputies, they go to just a bunch of different types of calls. It doesn't have to be a mental health call. They've definitely helped us with scenes that are very traumatic, with accidents and deaths and tragedies, and being able to work with families. It's an incredible task that we ask our deputy sheriffs and our police every single day. And it's not to say that they don't have the training and they're not compassionate. They absolutely are. It just helps having a partner that is trained in that absolute career that can bring light and showcase, really, while the deputies are there, and really showcase for the deputies that on-the-job training on what works.
Oh, that's true too.
With people in crisis.
That's true.
They get to see the clinicians in their space and see how they interact with folks, and it just adds to your tools when you're say on a call for service and you don't have a clinician, because we have 2 clinicians, so they work on the day shift hours. So there's many calls for service where we don't have a clinician car available.
I bet.
So I think that overall it's just really opened all of our eyes up for how can we best service our community members in Nevada County. And just because there's a violent issue or a crisis issue doesn't mean you need someone to determine if a crime was absolutely committed and someone needs to be transported to jail and enter the criminal justice system. Sometimes it is just referring people and getting people into services so that families can really just take care of their loved ones, and people live great lives here in Nevada County. The calls for service, they respond to a lot of them. And the feedback that I've received from community members that have received services and folks that have had the opportunity to meet our clinicians and our deputy sheriffs, it's all been very positive.
One of the things we learned on this show last night was about behavioral health in the county, and she explained the history of during the Reagan administration, when all the mental health hospitals were shut down for good reasons, and yet what didn't happen after that was something to take the place of treating people, with mental health. And by the way, at least in my opinion, I think all of us, should be attending to our mental health just like we do our physical health.
Absolutely.
And so, but that isn't really available to us. That type of help isn't available to us. So what do you think, like when you said there's 2 clinicians in the entire county and they work during the day, what do you think the chances are that anything will change with that, and that will be increased and what types of things need to happen to increase that?
Yeah, so at the state level, they have created a mobile crisis that are just 2 clinicians, and every county is by order of the state is supposed to have a mobile crisis team available 24/7, every single day, whenever. That's a 2 clinician car or team that responds in the community, and we also have that. So we work very well with our behavioral health mobile crisis team. So they are available. The issue comes down to is if it's a scene that might not be safe because of violence. And if there's known violence based off of the call, wanting to make sure that the deputy sheriffs and the police departments have been notified so that the clinicians are safe. That is the great thing about having a clinician and a deputy together, is the deputy's ensuring the safety of that clinician, and the clinician then is able to work, where the people are. When you don't have a safety aspect, the mobile crisis team from behavioral health will call us, and then we'll respond as deputies with the behavioral health team.
Okay.
So there is more services for folks that is good to see. And we started our mobile crisis team in 2020, and this behavioral health mobile crisis teams have just started in 2024. So I think the state is looking and watching and seeing what is successful in communities. There still is the stigma of if you bring a law enforcement officer, someone's going to go to jail, and that's not always the right tool.
Okay.
I say that's not always the case. We definitely want to ensure safety, and sometimes scenes are not safe. Yeah. And those clinicians, just because they want to help doesn't mean they should be exposed to an unsafe scene. Yeah. Whether you're looking at mental health or any type of someone that's under the influence of substance, under the influence of rage, it still takes someone's cooperation to be able to provide assistance to them. We can de-escalate, we can have great conversations, we can try to calm things down, but even if we do everything right, we still might have a horrible outcome. So I think it's definitely beneficial to have at least both types of teams, so that we can really ensure safety. I think that is the biggest piece to all of it. That's what everybody's looking for. Is we all want to be safe. Doesn't matter. Yeah. That's the. We can look at crime statistics. We can look at all those different things. But if you feel safe, you're in your life, you're gonna flourish. And that's the goal with having crisis teams to respond and assist you.
Yes, and you're right. They're both very unique skill sets. Even though I think, the bar has been raised for the law enforcement to deal with, to almost do a clinician's job, right? I mean, to be partially, at least, I don't mean to discount what, the contributions a clinician could make, but certainly I think that the jails, the ERs, and the actual officers have been put kind of, on the spot, dealing with mental health issues. And I also want to circle back to something else you had said, because a probation officer told me the exact same thing with you that you said, and that is that not everyone responds to the same type of treatment. So some people might, if they break parole, or not parole, I should say probation, if they break probation, for, let's say, they don't always just throw them back in jail, because if that didn't work, then it's not going to work this time either, probably. So like you said, you kind of personalize the treatment for each person, and that too, even though we were talking about how your organization is really organized more like a military structure, and yet you're expected to also, or at least you benefit from treating each person a little bit more personally, That's
the job of a law enforcement officer. we constantly are training into how do we create the best outcome for someone, and it doesn't always have to be incarceration. Clearly, when laws are broken and people are unsafe, that's why we have the criminal justice system.
Sure.
And sometimes that incarceration helps someone break a cycle, whether it be substance abuse or even mental health, to get someone on track with medication. I worked in this business long enough to see people that do benefit from incarceration time. It's not the lock them up and throw away the key and use that as a deterrent. It's stabilization of someone that's in chaos that I look at. And when we work at the sheriff's office, we have that connection with the jail. I am responsible for all of the incarcerated at the county level here in our counties, and to see people come in that aren't healthy, both physically and mentally, and then get some treatment and get some help and then get released in a better place, I think is also a key component to what law enforcement can provide.
Well, okay, we did talk about the structure, and I just wanted to make it clear to our audience that Sheriff Moon was elected, and her staff is hired and appointed, or selected, I guess I should say, not appointed as much as selected by the sheriff here. And so we're very lucky to have you in our community. And is there anything additional you would like to share before we go?
Yeah, just recognize that the deputy sheriffs that are out there are trying their hardest every single day when they get called to make things better. Not, our jobs are not to make things worse. Our jobs are to try to make things better. We're not going to always satisfy everyone to the level in which they believe, and that could be based on the law. It could be based on resources and time constraints on our response times on some calls for service. Like I said, we are a very large county for the amount of deputy sheriffs that we have. It's a difficult job being in law enforcement, but the people that we have that work for us, and I'll say that across this entire community with our police department, our 3 police departments as well, just some of the greatest people that I've had the pleasure of working with, and I know that every single day they're doing their best to try to resolve issues, fight crime. We have so many different services besides just policing and crime related issues with we have the entire issue with wildfires and disasters, and our teams are really trained in that evacuation process and then securing scenes and areas that have been evacuated so that we don't have crime in those areas. It's a really complex job. We're also coroners in Nevada County, so any death that happens outside of a doctor's certainty on someone's cause of death, you're going to have a deputy sheriff respond for that. It's a very complex job, and we have very committed staff that work every single day to try and make things better for people, and including the mobile crisis team.
Great. Well, we're lucky to have y'all.
Thank you.
So we want to thank Sheriff Moon and the many guests that appear on our program. Together, we help keep our community informed. This program is local news and information brought to you by locals. Remember to stay safe, take care of each other, and get out and explore all that this community has to offer.